There's a term in the natural world, natural medicine world, called leaky gut. Leaky gut. What does that mean? What is leaky gut exactly? And what does leaky gut have to do with other conditions? The connection between leaky gut and a compromised digestive system and things like prostate health, prostate cancer, testosterone. Today's conversation is with Dr. Mark Stengler, who is a naturopathic doctor in private practice for over 20 years. Dr. Stengler was voted 2021 Doctor of the Decade by the International Association of Top Professionals. He has served as in the medical advisory committee for the Yale University Complementary Medicine Outcomes Project. And he's the author and co-author of over 20 books. His current book is called The Holistic Guide to Gut Health. Discover the truth about leaky gut. Mark and I went through everything, or as many things as possible, related to digestive health. In our world of naturopathic medicine, when in doubt, the patient has too many conditions, too many health problems, treat the gut, right? Treat the gut. And we have those conversations. We talk also about SIBO. What is SIBO? This, where there's more unfriendly bacteria in your gut than friendly ones. We talk about IBS. Great conversation I have with the one and only Dr. Mark Stengler, the author of the great book, A Holistic Guide to Gut Health. Let's go. Welcome to the Dr. Geo podcast. I am your host, Dr. Geo, where it is my intention to help you optimize your prostate health, testosterone levels, erections, and how to live healthier and even better as you age. Today is my special guest, Dr. Mark Stengler, a naturopathic doctor, another colleague who is an expert in many things, but certainly in gut health. Mark, thank you so much for being on. Mark, as an ND, I've only had a few NDs. You're like maybe third or fourth ND that I've had. I've had many MDs and DOs on. So I feel I'm always get proud when I get high level NDs, my own people coming on and talking about holistic and naturopathic approaches, man. So I appreciate it.
Excellent. Yeah, it's great talking to you. And hey, thanks for all the great work you've done. The field of men's health urology, it's really taken the level up in our field in terms of a lot of people look to you for the research and keeping everyone abreast of what's going on, prostate health, men's health. So you really have set the bar for that.
Hey, I appreciate that so much. Thank you. Mark, the Holistic Guide to Gut Health. You have a book out, and when I think of prolific authors in our field, you come as one of the top guys because you've written so many books. Many I have here in my library. So now this book on Holistic Guide to Gut Health. If Dr. Sensenig, if you remember, who's no longer with us, may he rest in peace. I remember him saying this one line when he taught us way back in the day at University of Bridgeport School of Naturopathic Medicine. He said, "Look, if you have a patient in your office and you don't know what to do with them, you're just not practicing naturopathic medicine." And I raised my hand. I was like, "Man, I don't know what that means." He said, "First of all, you got to treat the person, not the disease. And if you still don't know, treat the gut. If you treat the gut, so it's one of our main principles to, as a naturopath is when in doubt, treat the gut." So just expand on that. Give us an overview on why that is the case. I feel like that's the case. Look, when we look back 20 years ago, when I was in school 20 something years ago, it was like, well, fasting might be a good thing. Oh yeah, but that's a naturopathic thing. I don't know. Well, much science shows now that fasting is a really good thing, right? For the most part. Hydrotherapy, right? We did hydrotherapy, water contrast, right? That is naturopathic medicine. Oh, that's some naturopathic, right? So cold water plunges and all these things. Everybody has a plunge now, right?
Big thing. Hold on.
Sunbathing. Yeah. the importance of sun and having sun exposure. Well, now we know, other famous podcasters talk about, early in the morning, get that 10-minute sunlight right into your eyes. Vitamin D, we know it's an important thing that we get from sun. So all these naturopathic approaches that 20, 30 years ago were like, that's quacky stuff that these NDs do. Now there's all this science to support that. So gut health. Give us an overview. Why is it so important?
Well, that's the same thing. When we were in school, I mean, I'm almost, 30 years now. We're in school, we heard these words like toxemia, toxemia and toxins created in the gut, is the root of all disease, the root of all evil. And, you're taught this, and okay, it kind of makes some sense. And it's, you see it in all the other cultures. You see it in European herbal medicine, Asian medicine, Chinese medicine. All these cultures for thousands of years have been saying the same thing. So we were trained on this. What I did in recent times was, probably like you, I saw a lot of people, when you treat gut health, all sorts of things beyond the digestive system get better. Skin rashes and skin problems improve. Mood improves, energy improves, sexual function can improve, all these things. Now, granted, we're not, some of these doctors who say every condition known to man, if you treat the digestion, is going to cure it. Obviously not. But for a lot of conditions, especially the chronic conditions, at least in part, the gut is often involved. And why is that? Well, there's some obvious things. I mean, our cells don't work by magic, so nutrients are absorbed through our digestive tract. So if we're not absorbing properly, and we'll talk about leaky gut, you can end up with problems with nutrient levels. And so they end up nutritional deficiency.
So you could eat a very healthy diet with all these nutrients, but it's not what you eat. You're not what you eat, like the line goes. You are what you can absorb. Is that right?
Yeah, actually in my book, I put you are what you eat and absorb. Because if you eat junk, what's to absorb? There's not much nutrients in it, right? So it's really kind of a combination, but I see what you're saying. So we have that aspect of how we can get nutrition to our cells, because again, our cells need all sorts of nutrients to work. So that's one. And then, of course, we found out in the last, 15, 20 years, the impact of inflammation in the body and the immune system coming from the gut. So if you read a medical textbook on it and all these studies, 70 to 75% of your from this lymphoid tissue, especially around the small intestine area, which greatly influences the immune system in a couple ways. Number one, if you get sick, it could be because, again, you got problems in the gut and you're having poor immune function. But the opposite is true too. Excessive inflammation in the body, autoimmune diseases. Plenty of studies showing a connection between gut health and these conditions. So, and then the third thing would be, of course, this microbiome, which, is in the trillions
huge
of cells. And microbiome, of course, we always knew it was bacteria. Now we know it's also viruses. We know there's fungi or fungus in there as a natural synergistic part of the microbiome, which influences everything too, the immune system, the brain, the heart, the prostate, everything. So we've got all these different dimensions of gut health. Now, when you look at the average American, everyone knows the average American doesn't eat well. So we know diet is a major cause of causing distress to the digestive system. Then you add on stress on top of that. And when you're under stress, you're releasing stress hormones, you get less blood flow to the digestive organs, you're getting less signals to digest food. Then you got all the medications people take, all the proton pump inhibitors, suppress stomach acid, help break your food down.
They're PPIs, Mark. Am I overthinking this? It's, if I remember correctly, PPIs are attributed or connected or correlated to dementia, correlated to aggressive prostate cancer as well. So our PPIs I think they're more of a problem. I guess in some cases I've never recommended them. In fact, in many cases I've had people come off of them and do other naturopathic things. But what is your research on PPIs? Am I overthinking it or exaggerating?
The ones that have been most well studied is, like you said, dementia. And probably has more to do, especially with seniors, like ending up with B12 deficiency. We know that's a risk factor for dementia. Your brain actually shrinks if you have B12 deficiency. We know bone loss. We do know PPIs. You can't absorb calcium, magnesium, vitamin D, other nutrients you need for bone. We know you're more prone to getting certain types of pneumonia. We know you're more prone to getting SIBO, small intestine bacterial overgrowth. And then you just alerted me to the prostate thing, which actually I had not seen. That's why you're the expert in that field.
Yeah. Yeah, no, I saw that, and in many cases, of course, my patients are thinking, "Oh my God, did I cause it?" Well, it's not that simple by taking a PPI, proton pump inhibitor. But I'm sorry to cut you off. I just really I see that that's one of the kind of contributors to poor gut health, and it caught my attention. I've been reading a lot of research on that on PPIs and its effect on overall health and ill effects on health. But continue,
Well, I mean,
please.
it's true. I mean, if you look at PPIs, they really were designed for short-term use. And because of
Yeah,
medicine today, the average doctor doesn't get to the fundamentals of why people have heartburn, acid reflux, GERD, with the diet, the stress, sometimes structural abnormalities, things of that nature. So, the patient goes on them, they feel better, they go off and they feel worse. You're not changing the underlying reasons why you're getting the acid reflux. Well, yeah, of course it
mm,
comes back. Weight, being overweight, of course, is a big
yeah.
one.
What are the three more common? I hate to get stuck
Mhm.
here on PPIs. I just think I think it's prevalent, the consumption and the intake of PPIs. But what are the three most popular PPIs that people are taking?
Well, I know for sure, Prilosec, omeprazole is at the
Pro-
top. I mean,
Yeah,
that's,
those are over the
yeah.
counter, aren't
Well,
they now?
yeah, the Prilosec is over the counter in a lower dose. That is true. I mean, they're
Yeah,
all in the PPI categories. There's some other categories of H2 blockers and stuff people use too. But the point being is, obviously, stomach acid has a function in the, several
yeah,
functions. It creates an acidic environment, so pepsin and pepsinogen, the enzyme break protein down occurs. It's a
yeah,
natural part of your body's protective mechanism, so bad bugs don't get into the digestive tract. Has that
yeah,
function, and then it's involved, as we said, in the absorption of minerals, the acidifying effect getting into the small intestine. And so studies have been done on this, and again, vitamin C, folate, B12, calcium, magnesium, D, C, and a few others have all been shown in research for a patient to be on PPIs long term to become deficient in those nutrients. So for people who are staying on them, and for the small percent of patients I see that need to, most don't, like you said, I mean, the least practitioners should be doing is making sure they're getting these nutrients supplemented,
yeah.
get the levels up.
I think I might have cut you off. Thank you for expanding on that. Again, I
Yeah.
just think it's for every, I don't know, 10 patients, at least one or two, I feel are taking some form of PPI, and I think it is an important topic. I think you were going over the all the ill problems why the gut health gets compromised, and you stopped at PPI. Are there any other reasons, any other causes to that?
Well, certainly, I know some people have chronic infections in their gut,
Yeah,
because of PPIs and antibiotics. Food poisoning can be a trigger too. This condition of SIBO, small intestine bacterial growth. I'm always surprised how many people, when we do testing, do have this issue. And they're prone to classic symptoms. Gas and bloating would be number one. The number two, you
mm,
could be prone, depending on the type you have, you get constipation, diarrhea, you get brain fog and malabsorption, you get leaky gut syndrome, which we can talk about. So, it's stressing the small intestine, causing damage to the lining of the small intestine. People have
mm.
parasites. We see a lot of dysbiosis, just imbalance, in the bacterial floras. Virtually everyone we see has that to some degree or another. Um, those are, very, very common reasons why people have.
Let's talk about SIBO,
Yeah.
Mark. How do you test for SIBO? What's your approach? I have to admit that I don't test for SIBO because, of course, everything is connected to everything. So there is some connection to testosterone, erections, and prostate. It's just that there's only so many things I can do. So I have to say that if I have to pick one area where I'm the least expert in, it would be as it relates to SIBO and testing. So how do you
Yeah, no
test for
problem.
that?
It's a breath test. Normally, someone is
Yeah.
they breathe into a bag, they get a sample, a baseline sample. You drink a sugar solution, it's usually glucose or another type of solution, and then about every half hour, you're collecting separate breath samples in the bags. They get sent into a lab. So you get the fermentation. If you have the SIBO, this overgrowth of bacteria in the gut, you get fermentation occurs. The gases come up and are coming out into the breath, and so this is measured. And so you'll
Okay.
see on the graph the levels going up. There's three types of SIBO actually. You got like the methane gas being produced. These people are usually more prone to gas bloating and constipation. You got the hydrogen
Mm,
form, gas bloating and diarrhea would be more common. And then you have the hydrogen sulfide form. These people, they get gas like smell like rotten eggs. Those are like the three
mm,
types you now can test for and identify. It's helpful in some ways because the patient knows what's going on with all the gas bloating, digestive symptoms. We have treatments we can do. Herbal, short period of time, putting them on a low FODMAP diet, types of foods which don't feed the imbalanced bacteria. And then you always have certain non-broad spectrum antibiotics you can use in more severe cases, like Xifaxan is a common one that can be used.
So SIBO, small intestinal bacterial overgrowth. What kind of bacteria? So we already said, well, listen, there's a lot of bacteria that's part of the microorganism and healthy for the gut. How do we know that, yeah, there's a few there that are not? Should we just assume that there are a few there, a few bad actors in there?
Well, you know what's weird about,
how do we know?
It's kind of weird and grosses people out. In SIBO, the bacteria is coming up from the colon. It's bacteria moving up from the colon into the small intestine that shouldn't be there in that type of environment. Now, they have done studies and they find it seems a lot of people are predisposed to SIBO who've had food poisoning in the past. It seems to damage the motor neurons, and so the natural peristalsis wave-like activity isn't working like it should, and therefore, you're kind of getting a backup of the gases. So these people, one of the things you have to do in treating them short-term and long-term, you've got to make sure their bowels are moving well, because 50% of people that get antibiotic treatment for SIBO relapse. It's a high relapse rate. And really? That's because, again, their peristalsis is affected, indefinitely. You got to keep the bowels moving using herbal products or whatever you're going to use, magnesium herbal products, better diet, of course. And so if you don't address things like that, the person's going to relapse. Other treatments are supporting stomach acid. Betaine, HCl, and pepsin is one of the treatments that's used. Supporting bowel flow from the liver and gallbladder, which of course helps with, peristalsis too. So there's a lot that can be done both in acute treatment.
Mark, briefly define peristalsis. My audience, there's a few practitioners, but a few are, most of them are what I call self-health advocates.
Sure.
So
explain
that a little bit.
Yeah, peristalsis is the wave-like contractions of the gut that move the food down, basically from the esophagus down through the stomach, small intestine, colon, and out through the rectum. These natural wave-like contractions propel the food downwards.
Mark, when you have a patient and they're coming in, they're saying, look, I get bloated a lot. My flatulence, everybody says it stinks like eggs or rotten eggs or something. You're like, okay, we're going to do a SIBO test, but I'm pretty sure that this is SIBO. Like, are there times you're saying, look, let's forego the test. I know what's happening. Let's get right to the treatment, or you always order the test?
Yeah, sometimes we do. Honestly, it kind of depends on the mindset of the patient. There's some patients, they got to see it on a lab test to be motivated to do the treatment. Maybe it's probably more of us Californians, you know what I mean? In New York, you guys are like, get me my treatment now. I don't want to wait for
now. I don't care. I spend a lot of time with patients telling them, look, this is what's happening and this is what we're going to do. This is why we're doing it. Most of them don't care about the why. They care about, let's just get right to it and get me better.
Interesting.
Yeah. So it's the opposite out there.
A lot of people want to see the tests. A lot of people want to. Anyways, yeah, absolutely. I mean, you can tell a lot of the classic symptoms. And look, I mean, when you improve digestion, you improve the diet, a lot of the SIBO is going to improve anyhow. Yeah. You don't have to necessarily go in with the heavy hitters like the antibiotics and really harsh herbs and things like that.
So you already said, all right, some enzymes, hydrochlorine, hydrochloric type of enzymes, do they typically contain other enzymes like lipase and proteases and things like that to digest proteins and fats and so forth, the ones that you prescribe?
Yeah, I do use full spectrum microbial derived enzymes, which break down everything: protein, fats, carbs, gluten, sugar, lactose, everything.
Wow.
Everything, because, I'm sure a lot of people eat out a lot.
Who wouldn't take these, Mark? I mean, I think every right. This is one of those things that you could put in the water, and you probably have a bottle right next to you. That's right.
You order food in at the clinic. I've got.
Yeah, that's right.
Well, digestive enzymes. I mean, look, they're pretty cool in that. I mean, they help people break food down. When people are under stress, I mean, they're just not going to break food down better. And of course, we always help people improve their stress. We give them recommendations, and some people do and some don't. And some people have life circumstances. It's not so easy. But if they have chronic digestive problems, the enzymes will improve their digestion. They're going to get less, digestive symptoms. They're going to get better energy from it. So is it a Band-Aid? Yes, because we can use herbs to get your own digestion working better too. But hey, it's better than, taking PPIs and Maalox and all sorts of other pharmaceuticals.
Absolutely. What kind of So I'm assuming you use to treat SIBO, you use herbal
Hmm.
antimicrobials. Is
I'd
that
say
right? And so what
90% of the time, yes, and maybe 10% antibiotics.
okay.
Yeah.
Okay. And what are what are the heavy hitters in our herbal world from an antimicrobial perspective?
Well, interesting. I don't know if you want me to avoid using brand names.
No,
Okay,
it's
I
fine.
mean,
That
I'm not
doesn't
associated
matter.
with the company, so
Yeah.
so
And maybe the ingredients, the actual herbs and things like that, but that's
yeah.
fine. Both are
I mean,
fine.
there is
Yeah.
some crossover between them. So interestingly, there's been two sets of products which have human published studies on them showing they're effective for SIBO. One is the
Oh.
company Metagenics. They have products, Candibactin AR and Candibactin BR. The combination of those two was shown in a human published study to help SIBO. So that's one option to do with patients, and it has oregano and a lot of the common herbs that are used. The other one, which has been used, which is kind of a more, it's quite a bit of a different form of Biocidin. I don't know if you've ever seen the
Yeah.
Biocidin. That
Sure.
has a human
Yeah, I'm
published study
familiar.
on as well. And so, like you, I'm just very, evidence based as much as I can use one of those tools.
Yeah.
I've used the Biocidin more, and generally it's worked pretty well. Again, you have to do along with diet changes, get their bowels moving,
Yeah.
help them break food down better. Um, so 90% of the time, I put patients on one of these herbal combinations, usually for about a good 4 weeks, up to 6 weeks, and I follow up with them. And most people have significant improvement. If the patient wants to retest the SIBO test at some time in the future, we can. But if their symptoms are doing really well, I say, what's the use? When people come with just,
Because they need to see it, Mark. They need
yeah,
to
some
see.
do,
They need
some
to,
do. That's
right?
true. Some do.
Uh, When do you replenish their healthy bacteria? Do you do it simultaneously, or do you first kill the things and then replenish
It's a
later?
good question. Some authorities feel that giving regular probiotics actually aggravates SIBO. So
Hmm.
there are probiotics you can get that are very specific in the strains for SIBO. So I will use from the beginning and into the future for some period of time a SIBO specific probiotic. And there are doctors' lines that carry them. So that can be
What
done.
would be one or two?
Like Oracle
Just
Molecular
to,
Research, I use
yeah.
theirs a lot. They have a SIBO specific probiotic, and that has worked well.
Hmm.
And I like to use it preventatively just because, again, people are very prone to relapsing with SIBO.
Awesome. And I guess staying away from food intolerances and allergens and maybe things like gluten and dairy. Is that part of the program?
Yes, I mean, here's the interesting thing. If you have SIBO, then you pretty much automatically have leaky gut. And if
Hmm.
you have leaky gut, you usually are going to develop food sensitivities, which aren't inherent. You weren't born with them; they're not genetic. So, yeah, we usually do get people off the more common ones, dairy and wheat gluten. That is true. However, the cool thing is when you treat SIBO and you treat leaky gut, then often a lot of people's food sensitivities will improve, so they don't have to maintain this restricted diet. Which, by the way, is another symptom of SIBO or leaky gut is just multiple food sensitivities. People aren't born generally with lots of food sensitivities, and we've all ran into people and
Right.
they come in and say, you only eat 10 foods. Well, you pretty much know these
Right.
people have leaky gut.
Right. Leaky gut. Let's go right into it.
Well, yeah,
What is
really
what is leaky
well,
gut?
the crux really behind my book was this. You always have in holistic medicine this term called leaky gut. Holistic practitioners
Mm,
have talked about it for many decades, right? And it's
mm,
at the time it's this general concept. You get malabsorption through the small intestine, and then you get lack of nutrients, and you're absorbing toxins into the bloodstream and all that. So what I did the last couple of years, I actually went to the mainstream literature. Let's really put this to the test. Is this like somewhat, mythological, or is this hard science? And I was actually hundreds of studies in mainstream medical journals, even journals
mm,
you wouldn't even think about, like Journal of Endocrinology.
mm.
Um, these mainstream journals having published studies talking about and discussing research and stuff, leaky gut syndrome is true. I even got a quote from Harvard Letters talking about leaky gut and how it's true. So in the mainstream research, I documented multiple times in my book, got a lot of references. Again, this isn't like, in holistic, magazines and health journals. The mainstream literature is demonstrating that leaky gut is a real phenomenon. Basically, there's two things that happen with leaky gut. One is, in the lining of our small intestine, which is pretty interesting when you start looking at the anatomy and physiology of the small intestine, you got
Mm,
26 feet. Well, people always say tubing, but it's really a lot more than tubing. You have four different
mm,
layers within that small intestine. Okay,
Mm.
different functions. But the top layer, you have a mucus layer or mucin layer, they call it, covering this epithelial lining of cells, this one layer of cell. And then you have villi, these projections, okay?
Like little finger
Thank
like,
you. Yes, little finger-like
right?
projections. You know what that does? These villi, finger-like projections, that increases the surface area of your small intestine to the size of 2 tennis courts.
Mm.
So you have the size 2 tennis courts because you have this important role of having to absorb your food there. So very, very important. Anyways, with leaky gut, what's happening is from the causes we talked about earlier, you get damage to that intestinal lining, that epithelial lining in the villi, and two things happen. One is we have what are called gap junctions or tight junctions. So between the cells, of course, we're talking microscopically now. Okay, you have
Yep.
proteins that link them together. You have over 20 proteins that link them together. And so when damage occurs, you start getting a little bit of a space between the cells, the lining. And then
Mm.
you
Mm.
get particles and bacterial byproducts and things like that, which should not absorb into your bloodstream, absorbing through.
Mm.
That does,
Mm.
that causes a local inflammatory response, and then it can cause a systemic. And I'll talk more about that in a second. The other thing that happens, a lot of actually doctors don't know about, is you have a second thing that happens. The first one, we call it paracellular. So it's between or beside the cells. The other one's transcellular. So right through the villi projection itself, like the top where, the absorption is coming through, that you get leaky gut as well. So you get things absorbing through the villi improperly, causing an
Mm.
inflammatory response, getting into the bloodstream. Now, systemically, what has been proven beyond a shadow of a doubt is called translocation, which is a fancy way of saying these byproducts get into the bloodstream, like these bacterial byproducts, which shouldn't be there. They call them lipopolysaccharides, LPS, we call them. And then it goes in the bloodstream and then goes to different body, joints, and so forth. And then your immune system comes in with an inflammatory reaction, seeing as a foreign invader. So you can get joint pain, joint swelling, foggy brain, inflammation of the heart, whatever it's going to be. So these are the mechanisms that are going on.
So same with proteins, right? So
Yeah.
to kind of break it down for our audience, you eat a sandwich, and the sandwich has a protein and the carbs from the bread and so forth. The polysaccharides are these long chains of sugars, and essentially your body should break those down to monosaccharides, right? So that's absorbed. Things like glucose or sucrose. I forget the disaccharides from the monosaccharides, but the bottom line is you break them down into small products, and that's supposed to get absorbed in the small intestine. But when that's dysfunctional, these longer chains, polysaccharides, now get absorbed in an abnormal fashion. Same thing for proteins, right? So you break down proteins, they break down into amino acids. Those get absorbed under normal circumstances. But with leaky gut, these bigger, larger links of amino acids that are full proteins, they get absorbed and cause havoc as well, right, Mark?
Absolutely. Yeah, you're right. And then, like I said, some of the bacteria normally in the gut that's residing in the area that shouldn't absorb through, that absorbs through as well. So there's multiple things that can come through, as well as like toxins from foods, pesticides, other particles and things like that. Leaky gut, you get toxins that shouldn't be absorbed through. Those get in as well. So it's very interesting because, again, this used to be kind of not well understood, but again, it's all over the place in the medical literature. This is a real phenomenon.
Not well understood, but there again, I mean, not to tweet our own horn here as NDs, but we've been talking about something to this. I mean, I've heard the term leaky gut 20 years ago while we were in school, and it wasn't, the literature has caught on and science has caught on to even using that term and defining what that really means.
They've even done studies with people who are gluten allergic, like celiac disease, high gluten sensitivity. They've actually done studies, believe it or not, where actually given a dose to subjects, and then they've been measuring, in the small intestine, one dose causing leaky gut. They've done the same thing with alcohol, showing, just, a few drinks can cause a temporary increase in the permeability of the small intestine.
No kidding. Yeah. Wow. So listen, I've been talking a lot about alcohol intake for last year, 2 years, because I see what I see, and Do you drink alcohol? Yes. So social. Okay, keep it moving. Now I'm asking more questions
Yeah.
than ever before, and I've had a podcast on it. I just think that it's a problem in many ways, certainly for men in many
Oh yeah.
ways. And now I didn't know that even one drink can
So these people
can
are having a
can
couple of drinks every day, even a drink every day. Hey, not only does it deplete you of valuable nutrients, but you're setting yourself up for leaky gut.
red wine. Even alcohol is alcohol. Doesn't matter where it's coming from. Even red
Hmm.
wine. Yeah, yeah. You're out there in California. That's wine country, man. And you can't.
That is true. I'm in San Diego. We're pretty close to it. Well, you got two parts. You got
I,
northern and southern, but yeah.
you can't just go to the vineyards there and well you could. I mean, there's a price to pay, very small price to pay,
Well,
but
and of course, the other factor is, as you know, was it 2 years ago it came out, 2 or 3 years ago? Even one drink a day is an increased risk for many types of cancers. So, I mean, look, I'm not a
that's
legalist. I'm
right.
not telling, never have alcohol and all this. But I mean, depending on your state of health, your family history, how are you using
You know
it? I
what
mean, it's still one of the biggest health problems in society today, and people don't want to, face the
yeah,
facts.
Mark, I mean, I'm not going to completely digress, but here's been my take for the last several years on alcohol. If you have an alcohol problem and you know you do, you need to do something about it. Period. End of story. If somebody else thinks, somebody you love thinks you have an alcohol problem, they said it, you do, and all the things that it does, sleep dysregulation and all these things. If you don't have an alcohol problem, you're going to consume alcohol anyway. Some guidelines, I give my patients and myself guidelines, like 2 drinks a week, nothing more. Earlier in the day, if possible, so it doesn't interfere with sleep. Here's the thing: men have an issue with men are more lonely than women. Women socialize more than men. So Mark, if my friend Mark tells me, Gio, I have this bourbon from somewhere, it's like this aged 16 years, you got to come and try it. And I have, a few of our friends coming, and it's 4 of us, and we're going to kind of, you know, go and socialize over this new bourbon that you have. I want to go, assuming a few things. You don't have an alcohol problem. You control it well. You don't have, more than 2 drinks are always a problem. Things like that, the general guidelines. But I want to go, not so much. Yeah, wow, Mark, this is great. Yeah, smoky. Yeah, Mark. Yeah, cheers, brothers. How's everybody doing? And
Mm-hmm.
engaging. I think that's an exception. Making several assumptions into making several assumptions. I think that men getting together with other men and socializing is honestly it's great for health purpose. I think that it would the socialization may even counteract any ill effects
Yeah,
from
you made a good
a
point.
drink.
You made a good point. A lot of the men who have problems are even drinking
It's
more
it's
than
how
other
to be
men.
holistic but
Yeah, yeah,
realistic.
it's good.
And so anyway, I guess some people roll joints and smoke it. Everybody has their thing,
Mhm.
right? But how do you back to leaky gut? How do you test for leaky gut? Is there a test for leaky gut? And we have the breath test for SIBO. How do you test for leaky
You
gut?
can.
Or do you need to test for
I
leaky
don't
gut?
think a lot of cases you do. I mean, given the person's like symptoms, I should
Yeah.
mention if you got a chronic illness. I mean, if you've had, cancer, you've been on medications for autoimmune diseases more serious. Most people's chronic illnesses, they're going to have leaky gut just from the stress of the illness, the lack of proper nutrition, the medications. I mean, usually goes hand in hand. So, given their history and symptoms, no, you don't have to test, but in our area and you want to, and you can test it by stool. So this is a protein called zonulin, and your body
Mm-hmm.
releases that in terms of signaling to heal up those tight, those gap junctions. So you release zonulin. So
Mm-hmm.
if the zonulin level is high, it's showing your body's trying to address the leaky gut. So you can test that on stool. You can test it on blood tests as well. So there are ways
Oh, you
you can
can.
measure. Yeah, yeah. You can also markers on blood tests like antibodies to like actin, for example, like the protein filaments your body uses to repair the tight junctions.
Mm. Mm.
So there's other markers you can test to see.
Actin is a blood test?
You can measure actin antibodies on a blood test.
Yeah.
I can give you the lab if you want. But yeah, there's blood tests you can do. Look at antibodies with the proteins your body uses to repair. And so if the activity is high, you can pick them up with these antibodies actually.
And so one can assume, so actin, yeah, actin is in a part of every muscle, and that's what helps muscles contract.
Hmm.
Would we assume that if these antibodies are high, is that is connected to leaky gut, or is there another problem
It
potentially?
could be other ones because you do. So in the blood, it's a panel. So you do have the zonulin. You got some other markers. You know, it's a
Got it. All right.
combination. Stool usually just does the zonulin. Zonulin's the most well-studied one by far.
How often do you order these tests? In other words, they have these symptoms, the A, B, and C symptoms, whatever they are,
Hmm.
headaches or autoimmune. And do you order or do you go right to, I'm sure they have leaky gut. I mean, should we assume that everyone has leaky gut until proven
Pretty
otherwise?
much when I do the test, I mean,
Yeah.
again, depending on the patient, some patients like the testing, see what's going on, an overall assessment, but you can pretty much assume it. Like today, I had a lady, she is battling, some metastatic breast cancer, so all her treatments. So just assume she's got leaky gut. So I'll put her on some things just to help repair her gut, help, keep her gut healthy because she's on pain meds and
Yep.
stuff chronically. So she's going to have leaky gut. She's starting to get some gut symptoms, so you can just, certain things you can just assume it.
All right. So what do you do about it? So they have leaky gut. Now what?
Well, first in the diet, I use like a modified Mediterranean, the
Hmm.
most well-studied diet in the world, and modified because American grains aren't healthy. They're just
Yeah.
not healthy. So we have we take.
Expand on that a little bit because I know you've done some research on
Mhm.
that too. What's going on with American grains versus, I don't know, grains in Europe or
Yes.
Italy?
Well, we just have different policies here in America when it comes to food,
Yeah.
contaminants, how they're refined, and so forth. So American grains tend to be much higher in gluten, is one thing
Hmm.
compared to European grains, for example. Number two, we don't have standards for glyphosate Roundup. In my book, I did talk about some research where they have found that glyphosate not only causes leaky gut, but may trigger the gluten sensitivity itself. In other words, you ever wondered
Mm.
why in the world do so many people seem to feel better off gluten? Now, it could be one of two reasons. It could be because the other reason American grains are so bad, they're so refined, even the whole wheat products, that they break down or metabolize very rapidly, spike your blood sugar and insulin, which, by the way, if you just Google like Harvard glycemic index rating of foods, you'll find that whole wheat has a worse rating for spiking your blood sugar levels, your glycemic rating, than Coca-Cola or soda pop. And of course, white bread
Man.
is worse. People don't know that.
Hmm.
People try and lose weight. I'm going to get a whole wheat sandwich today.
Or are they just trying to be healthy and they're saying, well, I'm eating a whole wheat sandwich, I don't know, low fat ham and, processed meats and all kinds of things. Yeah, people don't know what they don't
Yeah.
know.
So you take all those factors, high amount of gluten relative, say, to Europe and other parts of the world. You got the glyphosate, which may trigger, a cross reaction to gluten, causes leaky gut, and then the blood sugar insulin issue. So those are problems. So, anyways, a modified Mediterranean, getting the gluten out for a period of time, not necessarily forever. Dairy free usually. We use other grains like the quinoa and the brown rice, chickpea pastas and things like that. And then
What do you use? Are you testing for sensitivities and intolerances and food allergies?
It depends on the patient. If they're open to it, I do. And I'll tell you why. Because it does help to motivate the patient to follow their diet. In other words, I can say, you
Hmm.
probably have gluten sensitivity. Oh man, that's a lot of work. That's a lot of stress. If they see high levels in their testing,
Mm.
often their mindset changes. So I will do very extensive, especially gluten testing. I'll run panels which measure about 12, 14 markers of gluten sensitivity along with gluten allergy, just to make sure they're not in that 0.8% of the population that has celiac. So if we can, we
Hmm.
do. But I always tell the patient, look, you probably have leaky gut, and I know you seem to be reacting a lot of foods. Most likely, we help your leaky gut. You won't have to be on a restricted diet indefinitely. You still want you eating healthy, but you don't have to be necessarily
Mm.
avoiding all these foods indefinitely. So give them some positive news with that.
All right. So staying away from food problem foods is one. Probably you would say number one on the list is grains
Well,
or
that's been the most well
American
studied. The
grains.
gluten has been, there's tons of studies on gluten causing leaky gut. There's just a lot of studies on it.
Mm, mm,
You just
mm,
can't deny it.
mm,
Very well studied.
mm.
Alcohol is out of the
So what
question.
else? How do you heal that lining? How can we get those villi finger like substances,
Theo?
structures
I
to extend themselves and to be healthy
I
again.
just wish there were some other ways. I'm teasing. No, so I
I mean,
I almost always put them on. I put them on a combination product which contains aloe vera extract, DGL
mm,
licorice, slippery elm, quercetin. Any people can get these things individually, and there's many companies that have these kinds of
hmm.
formulas, But basically, aloe vera.
What's the category in botanical medicine? Mucilagens, I want to say, or
Well,
something
the
like that.
slippery elm is mucilaginous, you know.
Mucilaginous, yeah, that's
Helps
right.
things move through. It's kind of gel-like. It's soothing. It's soothing. But I think
Hmm.
the powerhouses really honestly are the aloe vera extract. Is very
Mm,
anti-inflammatory, healing to the gut lining.
yeah,
DGL has been very well studied for healing up the gut
yeah.
lining.
DGL, right, from licorice
Yes,
without the
yeah,
deglycerinized licorice.
deglycerated licorice, DGL. Why do we use
Hmm.
that form? There's literature out there, and people take high dose licorice. It might increase blood pressure and cause your
Yeah.
potassium to be off, and it's, in my opinion, very rare, but nevertheless, so we use DGL, so people don't get worked up about that. And yeah, so we put them on a product like this for 2 to 3 months, and that's what accelerates the healing. Because if you do diet alone
Mm,
and stress reduction, it works. But when you put in
hmm.
these types of natural compounds, you basically speed up, I'd say 3 to 4 fold. You reduce the healing time. In addition, as I talk about in the book, studies have been shown that your gut lining needs vitamin D to be healthy, the small intestine
Mm,
lining. It needs vitamin A, and it needs zinc. These are things which have
mm.
studies on them for leaky gut. I'm sure there's other
All
nutrients.
important for testosterone production, D, A, and
Yes,
zinc.
sir.
So I wonder the connection. We'll talk about that in a minute. If any connection between gut health
Yeah.
and male reproductive organs.
So yeah, so being on those nutrients or being on a good multi, getting a base of those nutrients makes sense. Just, your gut nutrients too to be healthy. And then of course, we have meal planning with prebiotic and probiotic
Mm,
meal planning. We actually have it in the book.
yeah.
We give it to handouts as patients too. So that, again, feeding the good bacteria with the prebiotics, providing the direct sources of probiotic bacteria so your gut is healthy in general. And then for a period of time, a short period of time, put them on high quality human studied probiotics to accelerate the healing. I always tell patients, look, long term, you're going to colonize your gut much better through the diet, the prebiotics and
Mm.
probiotics. The probiotic supplements get people feeling better much more quickly. But in the long run, it's the diet that's going to keep that gut healthy.
Holistic Guide to Gut Health. That's the name of the book. Mark, how do you go about prescribing probiotics? I'm at a loss. I don't trust that the products are doing what they're supposed to do. They get to where they need to get, they populate the way they're supposed to populate. I want them to eat kimchi and raw sauerkraut and take
Mm-hmm.
prebiotics versus probiotics. Is I just don't know what to
Yeah.
prescribe. What are your thoughts? What do you do?
Well, it is the dirty secret of the supplement industry. As one who,
Mm,
consults for companies and has my own line, I'm just telling the truth. And here's what I tell people, and this is the truth. If you walked into a health food store, you walk into a pharmacy, you walk into Walmart or whatever, my experience is by looking at bottles and stuff, probably 85% of those products, maybe 90, are using probiotic strains which have no human studies. We don't know what they do. Apparently, they don't
that's
make
right.
people sick very much because we don't get, there are, thousands of complaints every year. But my concern is more that are they getting a therapeutic effect? So I only
Hmm.
use probiotics, this limited number of them, which have human studies on the strains, which we know survive the stomach acid. That's barrier number one.
Right.
Barrier number
That's
two,
right.
do they have, the amount in there at the time of purchase as they say there is? Okay. So those are my two criteria. And again, that really narrows down the field. Patients come in, they got this probiotic. Mark, look at this thing. What do you think about this? Take a look at it. It's got 14 strains in here. It must be great. How much you paying for that? I'm paying $59. I go, I wouldn't use it. What? I wouldn't use it. You don't have one strain in here as a human study. You don't even know it's
That's
going to
right.
help you at all.
That's right. That's right. So there are a couple of companies maybe that do a better job
Yeah.
Once again, if you want to mention either strains or companies or one or two, that's fine by me.
Yeah, well, I mean, honestly, the doctor's lines, I mean, there's definitely, most major doc lines will have probiotics with some human study strains. It's not really a problem in the doctor's lines. It's the retail lines, they're very
I
problematic.
see. So I don't know, what is it? Ortho is it's just a great
Yeah.
company. I know they have a
Yeah,
few
orthomolecular
probiotics.
research,
Orthomolecular,
Zymogen has human studied strains in
Zymogen,
their
yeah.
probiotics, as an
hmm
example. Those come off the top of my head.
What happened to Natrins who, they were the probiotic company, right? That's all they do. And I hold them to high regard, and for a while I said, yeah, pay the higher money for Natrins because, this is all they do. Do you still recommend any idea if they're still reputable?
I honestly
I'm out of
haven't really
touch.
followed them, to be honest. I'm not sure. Yeah, to
Okay.
be honest. I mean, look,
So are
there
you
are
true?
products now, food stores, which have human studied strains, but people are just have to be aware of it going in, what they're looking for.
Great. So you're treating SIBO and leaky gut simultaneously?
Yes.
Okay. I didn't hear you mention glutamine.
Wow. Must be the end of the day. You're exactly right. Isn't it?
Mark, no excuse for you. It's not even 7 o'clock by you. It's almost 10 p.m. by me. So
That's
come
true.
on, man.
That's true. Yes. So in that formula, I do use a total of 5,000 milligrams of glutamine a day. And you're exactly right. Glutamine, people know that it your muscles is a fuel source. However, what I found in the Journal of Nutrients, a very mainstream, nutritional journal, the gut has the highest need for glutamine, the small intestine. So it helps these enterocytes, these small intestine cells, to turn over and become healthy. Now, what's interesting along the glutamine lines, did you know that your small intestine replaces its cells every 2 to 3 days?
Not that frequently. I would not have guessed that.
Yeah,
No.
that's what the
Every
literature
2
now
to 3
shows, every
days.
2, 3 days. Why is that? We have stem cells produced in that bottom layer. I said there's the 4 layers of the small intestine. We have stem cells that are produced. They come up to the top lining for healing, regeneration of the lining, which makes sense because think about it. If you damage your small intestine, it couldn't repair. I mean, we'd be dead a long time ago. So very interesting. The problem comes in if you're always eating foods or taking medications or always can't control your stress. And so it's always healing, but it just can't ultimately heal it.
Interesting. Fascinating. So the reality is that we can link, I mean, they call it the second brain, right? The gut, the great book written.
How do you know it's not the first brain? No,
that's true. Is that your next book, The First Brain?
No, I don't
Seriously.
think it is, but here's the thing. For example, we produce more serotonin in our small intestine than we do up in our pineal gland, which is one of our major neurotransmitters, is it not? We produce a ton of melatonin in our small intestine.
Wow.
And who knows what else they're going to find. So the point being is and I do go over this very extensively in the book because it is a big area of research now. And they call it the gut-brain axis. But remember, it works both ways. We're always taught, which makes sense, how you're thinking, how you handle stress, you affect your digestive system. You got irritable bowel syndrome, well, you're not handling your stress well, which is only maybe a little bit true. We have the longest cranial nerve in the body, right? The vagus nerve comes down through the neck, innervates, different parts, the heart, goes down into your gut. So you have a direct communication from the brain to the gut. Everyone knew that, but now they've shown that it's bidirectional. You have a communication between the gut through neurohormones, so neurotransmitters, hormone-like chemicals, and the microbiome sends messages to the brain. That's why they're furiously studying right now treatments for the gut microbiome and gut to help people with anxiety and depression. And they have shown in some preliminary studies you can make an impact, on those conditions.
So if you treat your gut, you treat your brain.
And of course, it goes beyond that, good cognitive function, for memory and focus and all these types of things. So that's why, again, the gut should at least be considered when you're trying to help someone with mood disorders, memory problems, cognitive problems, concentration problems.
Fascinating. Gut prostate connection?
There,
What do we have?
you
Anything?
know, we men in the prostate's usually lower down on the list for the researchers, but
Well, it's lower down in the body, so if it's lower down,
but yes, I did find in the research the gut prostate axis. I also found the gut bladder axis they found.
yes.
So there's a communication network between the two. I also found the gut, and you'll be happy about this one, the gut testicle axis.
Whoa. All
So
right.
they found,
Tell me
well,
more.
they found that I've got my book right here. I'm cheating on you. Page 43.
That's all right.
Leaky gut can result in immune system activation that can negatively influence the testicles and male reproduction. Moreover, the testicles have been found to have their own microbiome.
Sure. Yeah.
And then they've done
have.
research on the microbiome of the testicles and the gut and sperm
Mhm.
numbers and quality. So yes, they are looking at this. It's connected to everything, but including that. So Ultimate Men's Health, one of the reasons you help men holistically, besides, those organs themselves, working on the diet and the digestion, the gut, it helps as well.
Yeah, prostatitis. I had a patient today with prostatitis. And he's like, I'm so frustrated, right? I go to all these urologists and nobody can help me. And, tamsulosin one prescribed, the other one on doxycycline. And I've already taken a bout of antibiotics and so forth. I said, frustrated. I said, look, everyone, the urologist means well, and they are as frustrated as you are. You treat when I teach things like this, you treat the prostate from prostatitis by treating the whole person. You actually, the more you move away from the prostate in a prostatitis scenario, the better chance you have to treating the prostate well from prostatitis. So in other words, treat the gut, treat the sympathetic central nervous system, right? There's a hyper sympathetic overstimulation, all these things. And look, all these things are, if I go back to my naturopathic days, I can't say that I treat the gut per se, but I think I do because I get them off of food intolerances, for example, and that's the first step. If I feel they have IBS, we take enzymes. I prescribe enzymes and things of the sort. But I think I'm listening to you, and I'm like, man, I think I need to go a little bit deeper on gut health. I need to go back to my roots a little bit more. I think anyway. Holistic Guide to Gut Health. Mark, thank you so much for writing such a great book, such an important book, so timely as well. Tell us more about the book, about you, your practice, and any final thoughts you have.
Well, I practice here, private practice. I'm in a suburb of San Diego, and I practiced in 28 years, and I enjoy it. I enjoy, naturopathic medicine, help people with a wide variety of conditions. So in this book, just because as naturopathic doctors were addressing the diet and digestion, just telling the lay person, what's going on with their gut, how to help it with foods, how to help it with lifestyle, supplements. And then I do have chapters on all the common conditions and how addressing the gut can help these conditions and other things they can do beyond that. And of course, if you have a digestive condition, irritable bowel syndrome, inflammatory bowel disease, acid reflux, these types of things, I go into detail how to treat, the gut to help those conditions.
Mark, are there gastroenterologists that will go down this route and say, yeah, there's leaky gut, or is that not just what they do?
Yeah, a matter of fact, there are some. Like, for example, the person who did the foreword to my book is an integrative gastroenterologist. As a matter of fact, he moved from San Diego to upstate New York.
Oh, I know who. I know who that is.
I mean, explain that to me. You think his microbiome's off, maybe affecting his?
He's a functional medicine doctor, isn't he?
Marvin Singh, S.I.
Yeah, Marvin Singh. Yeah. That's right. And I heard that. Okay,
we
great.
Have integrative gastroenterologists in San Diego, but that's it. And I know one in Los Angeles, but there are some out there. They're just few and far between. But yeah.
Road less traveled, just like urology, integrative urology, road less traveled. Mark, where's your website? And I'll post it on the show
thanks.
notes.
Yeah. My website, you can go to drstengler.com. Initials Dr. Stengler.
drstengler.com. Yes. Very good. Mark, thanks so much for being on, brother.
Hey,
appreciate
thanks,
you.
Dr. Gio.
All right, folks, this is Dr. Gio signing off. I hope you enjoyed. This is valuable. Listen, when in doubt, treat the gut. I've seen that over and over again to be a really valuable thing to do. So this has been a really good podcast. Thanks so much for listening, and I will see you next time. All the best. Have a great day or great evening, wherever it is nearby you when you're listening. So long. Thanks for tuning in to this week's episode of the Dr. Gio podcast. You can watch all episodes of this podcast and much more by subscribing to my YouTube channel on youtube.com/Gio Espinoza ND. If you love what you heard today, you can help by leaving a 5-star review of the podcast on Apple and Spotify, as each review helps us reach more men who are serious about improving their urological health and how to function better with age. And for the latest research and actionable takeaways in the world of men's health and integrative urology, sign up for my newsletter at drgio.com. I'll see you next time.